Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Sukesh Mantri, medical oncologist and medical director at Terrebonne General Mary Bird Perkins Cancer Center. Today, we're going to be discussing Prostate Cancer Awareness Month. Welcome to the show, Dr. Mantri.
Thanks for having me, Rhonda.
All right, well, let's get started with you telling us more about your role yourself at Terrebonne General.
Okay. Like you're aware, I was born and brought up in India. Did my medical school back in India. After moving here to United States to pursue higher education, I did my residency in Southern Illinois University, and then my oncology fellowship at East Tennessee State University. Currently, I'm a full-time employee of Terrebonne General, currently serving as a medical oncologist as well as a medical director for the cancer center here.
Okay, well, we're glad to have you here, Dr. Mantri.
Thank you.
All right, so let's get started with the first question. What is prostate cancer?
Like many know, prostate is a gland present in men only. It's a gland which is beneath the bladder in front of the rectum. Okay. Prostate actually makes some fluid that's part of the semen. Okay. But when the cells of prostate gland start to grow rapidly, it can become cancerous.
Okay, what are some of the main symptoms to look for?
Majority of patients are asymptomatic, meaning no symptoms from prostate cancer. Some of the symptoms of prostate cancer can overlap in other benign conditions like infections or BPH, known as benign prostatic hyperplasia. So there's a lot of overlapping symptoms, but majority of the symptoms are lower urinary tract symptoms. To be more specific, increase in frequency of urination, sometimes urination during nighttime, hesitancy. These are some of the common lower urinary tract symptoms. Some patients may have hematospermia, meaning when they ejaculate, they can see blood in their semen. That's also seen, and sometimes blood in urine. These are some of the common symptoms when it's localized to the prostate gland itself. Okay, when it spreads to other parts of the body, it depends on where exactly it spread. Prostate, when it spreads, it likes to go to the bones, so patients may experience pain in those areas of spread.
Okay, I know that there's a screening for prostate cancer. At what age should men get screened?
So that's a very good question. American Cancer Society suggests a discussion with their family physician for screening. PSA is a screening test generally that's recommended for men. Average risk men at the age of 50, they start screening with PSA. Okay, and patients who are high risk of patients are African American men, and two, okay, if they have a family history, either their father or brother with prostate cancer, if they were diagnosed earlier than 65 years of age, they should start screening at 45. There's also even higher risk category are those men who have multiple family members, two or more first degree relatives with the prostate cancer. They can start screening at age 40 itself. So they can start screening with PSA. And if PSA is less than 2.5, they can do screening every other year. But if the screening PSA is more than 2.5, they have to do once a year screening.
Okay, and what are some of the preventive services offered by Terrebonne General Mary Bird Perkins Cancer Center?
So there are a couple of screening programs in the community. The first one is Prevention on the Go. It's on September 9th. It's at Skinner's Barbershop in Morgan City. And we are screening for a couple of cancers. One is prostate and colorectal cancer. The second one is on November 5th. It's on the same day as Market at the Marina. It's opposite to the drive-through clinic. Okay,
Right.
These are the couple of community screening events that's going to happen in the next few months.
Okay, that one's a Live Well by you. All right, and why is Prostate Cancer Awareness Month so important?
So many already might be knowing, but second to skin cancer, prostate cancer is a very common cancer among American men. Okay, American Cancer Society predicts in 2023 there are close to 288,000 prostate cancers incidents in this year. Among those 288,000, approximately we see 35,000 deaths due to prostate cancer every year. Okay, easy math is 1 in 8 American men would be diagnosed with prostate cancer in their lifetime. Okay, and 1 in 41 deaths is due to prostate cancer. So because it's one of the common cancers after skin cancer, okay, and it's a common leading cause of cancer death, second to lung cancer, I think it's important to consider screening in patients who are healthy and have a life expectancy of more than 10 years.
Right. What are some of the comprehensive services offered by the Cancer Center?
So once patients are diagnosed with cancer at Terrebonne General Mary Bird Perkins Cancer Center, we often treat patients in a multidisciplinary approach. Okay, along with medical oncology and radiation oncology services, we do also have a nutritionist. We do have social worker. We have a nurse navigator helping coordinating the care too. So we have a multidisciplinary approach for our patients.
All right. Well, thank you so much for sharing all this helpful information with us about Prostate Cancer Awareness Month.
Yeah, it's my pleasure.
For more information about prostate cancer awareness or Terrebonne General Mary Bird Perkins Cancer Center, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.